But anyway, we have our first guest on the phone. I don't want to keep him waiting any longer because we appreciate the time that he gives to us each and every week. Jeff Bourgeois, the president and CEO of San Juan Regional Medical Center, is on the phone. Mr. Bourgeois, good morning.
Good morning, Scott. How are you today?
I am good, thank you. Thank you for calling in. We always appreciate hearing from you to find out kind of how things are going at the hospital. We've seen the numbers coming down. We hope that has kind of translated into lower numbers for you and your staff as well.
It has. We are well off our peak. That was the end of January. We still do have COVID-positive patients in the hospital, and we still have a total of 20 ICU patients today, both that includes COVID and non-COVID ICU patients in our separate ICUs, but fewer than 10 intubated patients, 6 to be more specific. And, that's the lowest number we've had in a long time. So I would say the message from that is very, very encouraging, but also we still need to acknowledge that there are some very sick patients still, and not a time to let our guard down. Still practice all the COVID safe techniques that we've learned, and let's try to continue to drive these numbers downward.
That's great. And good morning, Jeff. It's Megan. Let's talk about vaccination. Last time we spoke, you had vaccinated quite a bit of your staff. Are you guys at 100% vaccination yet, or how's that going?
No, we are not at 100%, but we continue to encourage those that haven't to continue to get the vaccine. I don't have the current numbers for our staff off the cuff here, Megan, but I was looking at the state's dashboard, and there over 607,000 New Mexicans have registered, and over half of those, 365,000. Let's see, there's been 264,000 primary doses, and then right at 101,000 individuals that have had both doses. So, roughly 5% of the state's population, and so that's really encouraging. And we're just continuing to have great results from what I hear in the county and the community with the other vaccine efforts that are going on. A couple of neighbors and acquaintances I spoke to over the weekend, one who had participated in a clinic at the San Juan College and another at McGee Park, and both were, initially concerned when they drove to the parking lot and saw all the cars, but they were amazed at how quickly and efficiently the process went. So kudos to all those who are coordinating that, because that is no easy task to make that feel easy on the patient showing up.
Right, and that was going to be one of my next questions to you, Mr. Bourgeois, about kind of the community effort to get folks vaccinated and make the vaccines available to folks who want them, no matter where they may be. We saw some events in the Aztec and Bloomfield areas recently, other efforts to maybe target folks who maybe don't have internet access or aren't available to maybe register through the state's website online, and just reaching out and doing other things. And I guess I would remember San Juan Regional's very early efforts to do COVID testing when you had your folks out in tents outside the hospital in drive-through areas. And again, kind of that kind of spirit, I guess, kind of continues with these vaccination efforts.
Yeah, absolutely. And the only difference is we're not leading those community based COVID vaccine clinic efforts. The Department of Health and other stakeholders in the community, based on the distribution of the vaccine itself to various pharmacies. So I think it's an effort that's proving worthwhile to distribute the vaccine to various pharmacies and other stakeholders, and of course the Department of Health to try to cover as many people possible. And the state has a wonderful COVID-19 vaccine dashboard. That's where I was pulling some of these numbers from. And just as a reminder, the order of priority still exists. So we encourage everyone to register. The state will contact you. And then there's phase 1A, which is essentially all frontline healthcare providers at hospitals and long-term care facilities, home care, hospice, et cetera. Those working in congregate settings such as homeless shelters and correctional facilities. And then phase 1B is persons 75 and over, and then persons 16 and over at risk of COVID complications due to underlying health conditions. And so once efforts are exhausted to get those first two groups, then there's some other subcategories within phase 1B that will also be targeted for eligibility. So I'm really encouraged. The epidemiology report I saw earlier this week suggested that the vaccine is now responsible for a 12% decrease in the daily incidence of new cases being diagnosed. So it is working. And that same report also continued to stress that COVID-safe practices are extremely important also in continuing to help control the spread.
Yeah, that's very good. And we have one more question before we let you go, Jeff. How are the numbers in other state hospitals? Are we still sort of sharing space with Albuquerque, or how's all that going?
Great question, Megan. Suzanne Smith, our chief nursing officer, and I are on calls twice a week, Tuesday and Thursday morning. So we just had one today. And most every other facility of the 7 regional hubs, so that includes Santa Fe, Las Cruces, Roswell, and then, of course, the 3 big hubs, Presbyterian Lovelace and University Hospital in Albuquerque, all have seen declining numbers. But a couple of those hospitals specifically noted very heavy census in the non-COVID related areas. And so, again, what we're concerned about as a healthcare provider is that people are delaying care, and then that's turning into more severe episodes of care had they presented sooner for care. So again, want to stress to all your listeners that if you have routine screenings or any other symptoms that's new and need to be investigated, please seek the health care you need. Do not delay, because we fear that it'll end up in sicker patients than we might otherwise experience if they presented earlier once they first noticed symptoms or did not delay routine screenings and primary care.
That's true. And I had a very great conversation with 2 of your cardiologists yesterday, Jeff Bourgeois, about that very topic. They were talking about some of the concerns that, folks experiencing chest pain or discomfort and maybe not recognizing that it could be a heart problem, heart attack, what have you, and to certainly stress that they get that checked out and certainly go to their primary medical provider or the hospital emergency department, whatever the case may be. But even they were saying they were concerned about folks maybe delaying important care, and that's something we don't want to see. And you at the hospital have taken great pains to separate potential COVID patients from anybody else that goes to the hospital, and that's to be noted.
Yeah, thank you for mentioning that. That begins in the emergency department and flows all the way to the inpatient unit. So there's safe and appropriate separation of our patients with respiratory illness and those with non-respiratory illness. And so really, we can't stress it enough. If you feel you need health care, please seek out the care you need. Do not delay.
Very good advice. Well, Jeff Bourgeois, as always, thank you so much for coming on. We appreciate your time that you so generously give to us basically every week. So thank you.